guest called and wants to speak to me. It is Kathy Maher. Kathy, welcome to the programme.
Good evening, George.
Pharmacist. Yeah?
Yes.
So you want to talk to me about?
Well, we welcome today's decision by the IMB to change the status of one medicine. It's Norlevo. It will be known as the emergency contraception. So it's now gone from prescription-only status to being allowed to be sold without prescription.
And you think it's a good idea?
Very good idea, very positive development for women who can now access emergency contraception without delay.
Yeah, but when this was first mooted, I was quite opposed to it. It's interesting that Darragh O'Loughlin, the president of the IPU, used words like "it is not a protector against sexually transmitted diseases. It is not a form of contraception." But human nature being what human nature is, people will see it as precisely that.
Absolutely not. You're quite right. It does not prevent sexually transmitted disease, and it's not a form of regular contraception. It's not intended, the very name of it. It's emergency contraception. It's only an occasional method. So at each opportune moment, the pharmacist will always speak to the patient and make sure that they're not using it on a regular basis, that it is used for emergency situations. And if they do need it on a more regular basis, then they'll be referred to their GP to discuss their long-term contraceptive options.
But nobody's going to tell you that they're using it regularly as contraception, surely. I mean, somebody's going to come into you and it may well happen in rural towns where there aren't too many pharmacies. But, I mean, certainly in urban areas, all they have to do is go to a different pharmacist every time.
Well, that's true, and the same can be said by going to a different doctor as well. That can happen. But studies have shown, and the experience in all of the countries where it's been available without prescription, is that the increase doesn't happen. Women just don't start taking it more because it's available without prescription. They just get it quicker access. They get it as an emergency form of contraception to stop any unplanned pregnancy.
But if you take it away just from pregnancy and contraception at the moment, there is a reasonably sustainable belief that the easier you make something to obtain, the more it is used.
Well, that could be applied to lots of things.
That's what I said. No, that's exactly what I said.
Absolutely. But studies, the most recent study in the BMJ, the British Medical Journal, showed that, I mean, it's been available without prescription in the UK for 10 years, since 2001. And the studies have shown that use did not increase, nor did use of other forms of contraception decrease. And we're not talking about people that are promiscuous. I would have patients coming into my own pharmacy, maybe 39, 40 years old, coming in, and they just have had contraceptive failure. That basically they forgot their pill, or they've had a tummy upset, their pill is less effective, maybe a condom split. Things like this happen, and this gets ease of access for patients. This is most effective when it's used within the first 24 hours of unprotected sex. So obviously, the earlier the woman gets to access that, the more effective that is.
Yeah, but there is also a phrase that says hard cases don't make good law. For every 30 or 40-year-old woman who comes in with a true emergency, the suggestion is that there are young people who, and we are seeing an explosion of unprotected sex in this country. Then you also have a situation of young people who say, this is great, I don't have to worry anymore.
We're also seeing an increase in unplanned pregnancy, and this is what this is about. It's to stop unplanned pregnancy. Teenagers and younger people are among the smaller groups that use it. Pharmacists are skilled healthcare professionals. Every consultation will be deemed, is that an appropriate sale or not? If it's not deemed an appropriate sale, the patient will be referred to a GP or family planning clinic. If, for example, it's gone beyond the 72 hours of licensed use, they may have to go to a casualty situation where they have to have an IUD fitted. So each case will be specific, but it doesn't mean that there's
But I mean, you seem to be defeating the idea that it's emergency contraception if, you know, a 17, 18, 19-year-old comes in to you, says, I had 10 pints last night at the disco, had sex, and then you decide arbitrarily or for whatever reason that they're not going to have access to emergency contraception, which is at its most effective in the first 24 hours. If you don't, you know,
so if they've no contraindications such as an anti-epileptic drug that can cause liver problems or such as Crohn's disease, if they have no contraindications, there'd be no reason not to sell it to a patient who's deemed appropriate. Just what I'm saying is there are patients that it will be appropriate for and patients that it won't be. Pharmacists will use their discretion and their judgment to make that call.
Well, do stay with me, because coincidentally you did mention Crohn's disease. Mairead is called. Mairead is with the Irish Colitis and Crohn's Society. Mairead, welcome to the programme.
Good evening, George. It's Irish Colitis and Crohn's Support.
Okay.
It's just a helpline.
All right.
To a listening line. And we have an awful lot of young women with Crohn's disease nowadays. It's a new phenomenon. It was a rare disease back in the 70s, and we even have children now, hundreds of children attending Our Lady's Hospital with it. But in particular, the young women or even older women, if they were to take the morning after pill, it could have a very bad effect on them.
But the point is, and I mean, Kathy can speak for herself, but she's already made very clear that there is a careful discussion before this is handed out, and all pharmacies must have consultation areas available for patients since last November. So one would have presumed that one of the very first questions that they would ask would be in relation to Crohn's disease.
Well, I've heard of other things being sold online to young women under 18 that shouldn't have been, you know, like diet pills were able to be bought in Boots Chemist, and Watchdog from BBC did a thing on that some time ago.
Well, I would just come in on that to say it's illegal to sell prescription medicines online to Ireland. So in that case, online pharmacy is completely illegal in Ireland. So
but Kathy, I mean, my email every single day is full of emails offering me all sorts of prescription medicines.
Well, George, you're right. Even last week, the IMB released a statement. There were 4,000 cases of online sales that they, breaches, as they called them, that they confiscated last year. We would call for people not to buy online because you don't know the safety.
You don't know the provenance, absolutely.
Absolutely, but in terms of
when young people are desperate, you don't know what they'll do.
Well, that's it. But in terms of Crohn's disease, when they come into the pharmacy,
I meant to mention ulcerative colitis, which comes under the same thing.
Absolutely, any of those severe malabsorption syndromes. If someone comes into the community pharmacy, and that's what this is about. It's about this medicine being available for instant access without prescription, and if they come into their pharmacy...
Well, I've no problem with that once I know that the pharmacist will ask this question, no matter who's buying it. Well, because it could do an awful lot of harm. You know, it also can affect your liver if you have liver problems, that kind of thing.
Well, that'll always be asked, because, as George said, all pharmacies since November have had consultation areas, but that can't be done just as a quick sale. The pharmacist will provide consultation to make sure it's appropriate.
No, I just wanted the public to know that for young women with Crohn's, it's not suitable.
Okay. Mairead, I'm really glad you called, and to both Mairead and Kathy who called me, of course, I have to declare that Ingrid is a pharmacist, so I just think lest anybody might consider one way or the other, my wife is a pharmacist. But my thanks to both my guests, and on an issue that most people will have differing perhaps views, but what is absolutely crucial is the point made by Kathy, is it's an emergency medicine, and nobody, particularly people of my generation who would have seen the tragedy of unexpected pregnancies, could possibly want that situation to happen again. My thanks to my guests. Philip Malloy joins me in a moment.